What's up, guys? It's Dominique, aka That Therapist. For those of you that don't know me, I am the lead clinician and CEO for a group practice known as Yellow Bird Counseling. We provide individuals, couples, family, group, adult, child therapy in four states, Alabama, Louisiana, Mississippi, and Florida. All right. So we provide therapy in those areas. So if you need individual, couples, family, group, child, or adult therapies, we'll be able to provide you with that. Or if you need counseling, we also provide counseling. So those of you that don't know, there is a difference between therapy and counseling. In short, therapy is if you have a mental diagnosis, and counseling is if you do not. In short, I have done a video on the more extended differences between therapy and counseling and how you can benefit for having a therapist for therapy and or counseling, or therapy that moves to counseling. So yes, there is a whole live on that. I can't even remember when I posted it, so that probably means that it's at least been a year. Okay, so I probably need to do it again. So I will do that so that you can see it and not have to search all the way 2 years ago for it. But what do we do here on social media? Well, we educate the general population on reasons that we could all of us, you, me, all of us, benefit from therapy outside of simply just having a mental illness. So each week we discuss topics that largely have to do with mental health, but not necessarily just a diagnosis. Do we discuss diagnosis? Yes, but again, everybody that needs therapy may not need counseling or vice versa. So the larger population probably needs counseling for the most part because they don't have a diagnosis necessarily. Okay, so we educate you on that, and we do that in an effort to break the stigma surrounding mental health and receiving mental health care in the community at large, but more specific to me, the African American, and even more specifically to me, the LGBTQIA plus communities, and why we need to receive counseling. And all of that's going to make more sense to majority of you after today's live. So please share this live, because this is super important information that a lot of people need, because a lot of people have been traumatized or victims of a trauma and don't even know it. And they are responding out of that trauma and don't even realize it. So I want to break it down, and I'm doing this in two parts. So today I'm going to discuss what is trauma, how is it caused, the different types, the impact it has on you. And then in a couple of weeks, I'm going to discuss the treatments for trauma. And I feel like I needed to assign that level of attention to trauma because so many people have been traumatized. I'll give you the numbers. I will give you the numbers. I will also show you an ACEs so you can loosely get a loose idea of what your level of trauma could possibly be for you. So this is a trigger alert. But if you want to be sure that you're a healthy, functioning human being and let me guide you to help and success, you'll listen. All right. Therapy is a boss-ass move. It is really not for people that are weak or anything like that. Therapy is for people that are ready to see themselves. They're ready to see the help they need, and they're ready to pour that alcohol on that cut so that it can be disinfected and healed. I liken receiving mental health treatment to that. If you have a wound on your body, are you just going to let it fester and continue to throw dirt in it and let it get infected and gangrenous so that you lose whatever part of that body body part that wound is on? No, you're probably going to go to the doctor, get the necessary disinfectants, the necessary bandaging, the necessary therapeutic care you need so that that wound can heal. So this is the same thing with mental and emotional health. And it also impacts your physical health anyway. So it's not all in your head. It's never all in your head, okay? All right? So let's get to it, why don't we? And y'all know how I like to start off, because I want to make sure that people have a full or the fullest understanding they can have for the platform that I'm on, of what I'm talking about. I want you to leave here learning something new, and please feel free to ask your questions in the comments, and I will answer them because I love answering questions. When you guys call me and ask me for services, I make sure you know it. All my clients know in their sessions, all my therapists on staff know. I'll ask them at least 3 times in the interaction, do you have any questions? Are there any questions? Do you have any concerns? Do you have any questions? Did we leave anything out? Because I love to answer questions and provide you with the fullest experience with me that you can get. All right. Am I perfect? By far, no, I'm not. But I do try to make each and every person's experience with me an educational one, a thoughtful one, and a considerate one. I do try to do that. So, all right, let's go. So what is trauma? For those that answer in the comments. How about that? How about everybody that's on, do these 2 things. First, share this live. That's the first thing. Do that. Secondly, type in the comments, what is trauma? I want you to type it down there, and I want to see what is everyone's definition of trauma. Okay, so I'm gonna let y'all do those 2 things while I take a sip of water. Share the live and then put in the comments what is trauma, and let me see what y'all put. I'm waiting. Let me know, what is trauma? Give me your best 2-word definition. Just 2 words that describe trauma. How about that? That might be a little bit easier. Just 2 words. When you think of trauma, what are 2 words that come to mind? All right, great. Here they go. The comments is coming in. Y'all are making me so excited. I love to talk to y'all. I really do. So Nicolette it says a disturbing experience. Yep. Trauma, something that causes pain, whether it's physical or mental. Yep. Something that has a negative, lasting effect on your mental. I can tell y'all therapists up in here are y'all mental health professionals, or at least the people that Googled. I can, but these are all good answers. Verbal abuse, absolutely. I'm glad you said verbal abuse, because when people think of trauma, they don't usually think of the verbal. They think of the more physical acts, such as sexual or physical. So I'm glad you said that. Trauma is damage, yes. Triggered emotions, yes. Life-defining experience that causes some type of pain, yes. Negative life-altering event, a distressing experience or injury. All these are great. Y'all are all great. Y'all are all great, okay? I love it. I love it. So I want you to give yourself a heart, hurt yourself, and pat yourself on the back, because that was great. That was great. And then share the live. Share it on your timeline, share it in your group, share it with your friends, because again, this is about to get real. This is real information that you need and that they need. We're even going to go over a trauma assessment, so in the comfort of your own home, you can get a loose idea, because this is still an assessment that needs to be administered by a licensed professional in order to interpret the results. Okay, so that does mean you will have to see a therapist to get a solid answer, but you can at least know the direction you need to go in after we look at the assessment. Okay, but let me explain it. So trauma is pretty much everything that y'all said, but here's a more concise definition. Trauma is the result of the result of exposure to. So when you got exposed to something, the result of that happening. So like if you got exposed to fire, you might have smoke inhalation, or you might have gotten burned. Those are a result of you being exposed to fire. Okay, so the result of exposure to one or a series. And that is important to differentiate, because that differentiates the type of trauma it is. A lot of y'all have been using one of them more heavily than you should in your discussions when you use the term. So we'll get there. Okay, but I want to break it down, make sure everybody understands. Okay, it is the result of exposure to one or a series of incidents that are emotionally disturbing. Okay, they're either emotionally disturbing or life-threatening, with lasting adverse effects on the individual's functioning. And that functioning can include, but is not limited to, mental functioning, physical functioning, social functioning, emotional functioning, and or spiritual well-being or spiritual functioning. Okay, so yes, if your functionality as a result of some event or series of events impacts you in those areas, then you've probably been exposed to trauma. Okay, you've probably been exposed to trauma. So again, I said there are two types of trauma in regards to actual trauma occurring. If whatever you've experienced, you're like, yeah, that has impacted me mentally, still to this day, more than likely it was probably a trauma if it was an adverse experience. Okay, so even if it affects just how you respond, or let me so there's this one example that when I worked in foster care, that stuck with me when I was at a trauma training. Because when you're in foster care, being in foster care is traumatic. Okay, being in foster care is traumatic. I can tell you as someone who has been in foster care that foster care is traumatic, and not always because something bad is happening to you, but your environment has been shifted and you've been ripped away oftentimes from your family of origin. And while they might be causing you some level of abuse and or neglect, that is still your family. Okay, so but this is the example that stuck with me. So there was a kid that couldn't figure out when every time maybe the foster parent or adoptive parent, they were making bologna sandwich, every time the kid would freak out when the bologna came out. Come to find out, that child was forced to eat bologna sandwiches before being abused. So it could be the color red, it could be the seasons changing, it literally could be things that are seemingly subtle, that you could respond adversely as a result of a trauma that you've been through. So the one type of trauma, if it's only been a singular isolated event that happened at one time in time, once in time, that, and you still have adverse reactions to it, starting as far as 6 months and on after, and some other diagnostic criteria, but that is your PTSD, post-traumatic. Dang, I said it so slow, I forgot. So, PTSD, okay, post-traumatic something disorder. Okay. Literally just forgot. I said it too slow. Post-traumatic stress disorder. Crazy. All right. So that's one, PTSD, which is a result of a singular event. Okay. Post-traumatic stress disorder. And the word stress is actually very important because when we talk about the trauma's effect on the body, we're talking about the stress induced by the trauma, okay, in the body. So post-traumatic stress, it's a stress disorder, okay? And then if you experience events over a period of time, such as being bullied, such as being verbally abused over a long time, such as, or a period of time, such as just anything that's happened over a period of time that's traumatic and you've experienced repeatedly, we call that complex post-traumatic stress disorder, or CPTSD. Okay, so singular events that you experience adverse reaction to 6 months or more later, it has to start at 6 months and continue. That would be PTSD. If it was a series of events over a period of time, that would be complex PTSD. All right, very important that you know the difference. Okay. So what are some types of trauma? And again, these can be isolated or over a period of time. So we have physical trauma. So if someone puts their hands on you in a way that you do not like and it causes you pain, then that is, well, even I'll just even say if they touch you without your permission, I would say, and it just like, that's not something that it caused you discomfort and distress. Physical abuse, sexual abuse, when someone takes a sexual pleasure from you without your permission, any type of sexual pleasure from you that involves sexual touch without your permission, that would be sexual trauma. Emotional trauma is when someone imposes something on you emotionally over, so they elicit an emotion from you that you don't like or that's not comfortable. So emotional trauma could be bullying, okay? It could be coercing someone to do something. It could be ignoring someone. It could be let's see. It could be saying one thing and acting another way, like in a response to someone. So like saying you love somebody, but like, you know, repeatedly doing something harmful to them, that could be emotional. So those are just some examples. All right. So that's examples of emotional trauma, which is a type of trauma. And then childhood abuse or neglect. And I'm not just talking about sexual abuse. I'm talking about verbal, emotional, and mental abuse too, because kids do get that and they don't get physically or sexually abused, but all of them are just as terrible. Unfortunately, DHR sees physical and sexual worse, even though mental and emotional impact people and adults very strongly and cause them the same or similar diagnosis that someone who has been physically or sexually abused experience. So that is a type of trauma. Living with family members with mental illness or substance abuse. I hear a lot of my clients who somebody drank a lot or somebody was mentally ill. Somebody drank a lot or somebody was mentally ill or somebody did like a hard drug. But mostly it was people will say I hear this a lot. So this isn't specific to anyone because this I've heard a lot. When I asked, so how was your relationship with mom or dad? Well, it was good. And I'm like, okay, so explain that to me. What is good? Okay, so do you feel like you were emotionally supported? And then that's when I find out, well, I didn't really talk to my mom and or dad a lot because they would get angry. And I said, oh, okay, what'd that look like? Well, my mom and or dad drank a lot. I hear that. My mom and or dad drank a lot. So there we go. Trauma number one. That's already started a trauma right there. So a lot of people, these clients would not recognize that as trauma. They did not recognize it as trauma, but it still impacted them to this day. Okay. So living with a family member with mental illness or substance abuse, sudden unexpected separation from a loved one, poverty, and here's the big one. I want my white people to listen real, real close. Racism, discrimination, and oppression. Those are types of trauma. I'm going to read them again. Racism, discrimination, and oppression. Those are types of trauma. So let's proceed. Violence in a community, war, of course, war, that's your traditional post-traumatic stress disorder, which I would beg to differ. If you were in war more than one day, then it's complex PTSD. Terrorism, workplace hostility, school, like bullying, cyberbullying. These are all types of trauma, okay? And so, let's see. So what happens as a result of those things in more detail as far as it relates to your like the aversion or the debilitation, it causes debilitation with long-term effects actually that was a different point. But y'all see how I tried to tie it in, but it was actually a different point. So that was a break. Please share this live. Do the things. If you know, if you got the text, if you're on the email community, do the thing so you can do the thing. All right. So yeah, those are the different types of trauma. Just in case you were not aware that you have been exposed, then you now probably think, have thought of something. And I'm saying you probably have because once I tell you the number of people that have experienced an aversion, okay, that causes them to be affected, they are, you're going to know that it's probably you. You've probably experienced it. And that's okay because guess what? Not only does Yellowbird Counseling provide individuals, couples, families, and group therapies, we also have myself and one of my other therapists trained in a specific type of trauma-informed therapy known as EMDR. EMDR, which I will explain to you more specifically what that is in 2 weeks, but it is a type of trauma therapy that I like to call the magic wand of therapy. I like to call it that. I've experienced EMDR myself and I swear by it, and my clients that I've done EMDR for swear by it as well. They love it. And they're like, oh, it was the relief I needed. Okay? So, and I'm also going to get trained in brain spotting. I'm not trained in brain spotting yet, but I am trained in EMDR. So, and one of my other therapists, and I was like, yes, immediately. Boop, 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 boop. All right. So great. So let me explain why the childhood portion of trauma hits a lot sooner, okay, or a lot harder. Not sooner and harder, of course, but you know what I'm saying? It is especially debilitating if a child experiences trauma. So a lot of you have probably experienced a trauma in your childhood and do not know it. And I, as a therapist, and my other therapist, we find out real immediately if you've experienced a trauma that you aren't aware of, because we do an emotional timeline from as far back and a situational timeline that we help you with as far back in childhood as you can remember to present, so that we can go over everything you possibly remember, okay? Or even think you remember, okay? Because even if you think you remember it, it has some level of reality and we need to assess it, okay? Because adverse childhood experiences highly impact adults, highly, and cause long-term effects. So it needs to be resolved so that the effects of it can begin to heal and resolve, okay? Let's see. Y'all are coming with the come on. Sharon, I'm sorry, said everyone has suffered from some form of trauma, even when they don't realize it. Oftentimes it's blocked out because we don't want to face it. Yes, and children have a survival ability when they experience trauma to dissociate, which means they detach from that reality in order to protect themselves. A lot of dissociation happens in children that experience trauma. So, which can lead to dissociative identity disorder later. I'm not saying it definitely does, but it can lead to dissociative identity disorder later, which is what y'all keep calling multiple personality disorders, but split personality, but split personality disorders and multiple personality disorders, which is also DID, is not the same. People call it DID. It's a very specific type of disorder. So, but split personality is not the same as dissociative identity. Okay, and I'll do a live on each of them. Okay, because I don't think I've talked about the dissociating disorders yet. So, because I talk about things that the general population of people can relate to, and a lot of people, the DID is in a small percentage. People diagnosed with true DID is a very small percentage. So, yeah. So you probably be like, what? You know, but I still will do it. Let's see. But the with children, trauma results in debilitation with long-lasting effects on their developing brains, okay? And so they say it's the first 1,000 days of a child's life are super critical. If they experience trauma in those first 1,000 days of their life, it can just really, cause some long-lasting effects. But I would even say within the first, you know what? Because I mean, yes, the first 1,000 days probably are the most critical, but I'm not sure how much worse it is from a 1,000-day-old to a 12-year-old, because there have been some of my clients who are now adults and their trauma came in like puberty. And it's like really, so, and it still causes them long-lasting diagnostic effects. So yes, okay, yes, but maybe that, and I think what more specifically, the first 1,000 days is probably when it will impact the brain the most. Like the development of the brain will be most impacted if a child experiences trauma in the first 1,000 days of their life. But let me tell y'all about how many of y'all have experienced adverse childhood experiences, better known as ACEs. And for those of you that like TED Talks, if you go look it up, ever since I watched that TED Talk, it was maybe like 5 years ago on ACEs, I was like, yes, exactly. So go, if you like TED Talk, go and look at that ACEs, and it's adverse childhood experiences, or ACE, and then an S for ACEs. Okay. So of the general population, 62% of people experience at least one adverse childhood experience. 62% of people have experienced at least one, all right, adverse childhood experiences. So that means at least 62% of you need to be sure that you have resolved that. And the best way to do that is check out a therapist that can be sure that and you may have resolved it, but cool. But wouldn't you like the peace of mind of knowing that you've resolved it and it's not currently impacting your life? Yes. So if you answered yes, definitely go to gilbertcounseling.com. Let me just put the text number up there so you can go on ahead and you're like, yes, that's me. Then this is all you got to do. That's it. All right. And then there are 25% of you that have experienced 3 or more adverse childhood experiences. So that means all in all, 87% of you have experienced one or several adverse childhood traumas. Okay? So it is common. So you do not have to be ashamed, because it is common. That's like what 4 in 5 people or something like that. 4 in 5 people have experienced at least one childhood trauma. That's a lot. Okay. So let's discuss what populations of people that it is most common in. Okay. And this is why me being a Black woman, this hits home. Adverse childhood traumas are more likely to occur in Black and brown communities. So your African American and or Hispanic or indigenous people communities. In people that have less than high school education. So if you have below a high school education, you have a higher propensity to a childhood experience of childhood trauma. If you have ever been exposed to low income living, okay, unemployment, without work, or if you are a part of the LGBTQIA plus community. So if you fall into one or more of those categories, or had when you were a youngin', then your propensity to adverse childhood trauma is higher, okay? Or your experience with trauma is higher, okay? It's higher, all right? And then the effects, we're going to talk about the effects of trauma, or what are your behaviors more likely to look like, or what risk are you more exposed to as a result of experiencing trauma? And I'm going to break it down. So this is the effects of if you've experienced 4 or more traumas, and we're gonna go and see. We're gonna take a look and see how many traumas you might have experienced. But if you've experienced 4 or more traumas or adverse childhood experiences, you are 2 times more likely to smoke. You're 2 times more likely to smoke. You're 2.5 more times likely to contract an STD or STI. You are 4 times more likely to experience some type of pulmonary disease. You are 7 times more likely to be alcoholic or experience some level of alcoholism. You are 10 times more likely to inject street drugs. And you are 12 times more likely to have attempted suicide. So yes, trauma is real and trauma is serious, okay? So for those of you that have found yourself maybe minimizing the trauma that someone has experienced, I hope this helps educate you on how serious it is and that it is not at all a joke. All right, so let's look at an ACEs assessment, all right? Let's look at it. So grab your pen and pencil. Grab your pen and or pencil. So that way, when you either text the word new below and you have your first session, or you find another therapy practice that you really like, you can say, hey, I was just loosely doing this as I was watching this live, and this is kind of how I scored. So what are your thoughts? And the therapist can help you. You can bring it with you. This is more of a tool. This is not a definite thing because, again, you do need a licensed professional to score this, okay? Say that. All right. But here are some of the questions. Oh, wait, shoot. I didn't share my screen. Sorry, y'all. I got so excited. I didn't even share my screen. Ha! Let me share. All right. Wait. Share. Okay. Let me bring it up. Here's the ACEs, adverse childhood trauma, or adverse childhood experiences assessment. So, while you were growing up during the first 18 years of life, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? So you would answer yes or no to that. If yes, you would enter a number 1, okay? And then it asks, number 2, did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured, i.e. getting spankings, okay? Y'all think whoopings is normal. It ain't. It's an adverse childhood experience that if you got hands laid on you in a way that caused you to be injured or marked up, or if you hit or were hit with something that caused you to be injured or marked up, you need to enter a 1 because that is an adverse childhood experience. And as soon as I read that, I thought of 3 off top. One time my dad hit me so hard in the back of my head that I had hit my dang lip on the sink and got a big ass fat lip. Then I used to get a lot of spankings as well that left marks and injuries. So, yes, you would put yes or no. Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Did that ever happen with someone, an adult or person at least 5 years older than you? I don't 5 years. I don't know, because it could have definitely been somebody 2 years older than you, and their stature could have been a lot bigger. But they say 5, so that's what they say. And this is this assessment was developed with some education, thought, and empirical evidence behind it. So we'll go with it. Did you often, this is number 4, did you often feel that no one in your family loved you or thought you were important or special. Did you ever even feel that? Or your family didn't look out for each other, feel close to each other, or support each other. That's a yes or no? And if it's a yes, then you would enter a 1. Number 5, did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if you needed. If that ever happened, you would enter a 1. So if you've entered a 1 for at least 4 of these already, let's get you in. Text the word new, okay? Because you are at a higher propensity, 2 to 12 times more likely to experience the effects that I had just talked about before I opened this. So pulmonary disease, STIs, alcoholism, I can't remember all of them that I said, but those areas where I was like, you're 2 times more likely, or 3 times, or 12 times, or 10 times more likely. Let's get you in, okay? All right, keep reading. Were your parents ever separated or divorced? Were any of your parents or other adult caregivers, were any of your parents or adult caregivers often pushed, grabbed, slapped, or had something thrown at them? So did you witness some level of domestic violence? Okay. Or kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? So you would enter a yes if any of that applies to you. Did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison? All right, and so this is the end of the assessment, and it says total yes answers. You would put there, and then it would be scored. Okay, and then your provider would score it for you, and then they would discuss what that means for you. All right, so you have a loose idea of how much trauma you've endured at this point. Let's see. Sharon Gray. I think verbal, mental, physical, sexual, bullying, trauma during childhood makes you create safe spaces in your mind, and it does make you feel like you have different personalities, but it's more of a safety mechanism to place those traumas away. It's like a lockbox to place your hurt into that only you hold the key to. Yep. This is serious, guys. I want you to heal and be better, okay? I want you to not have a higher propensity to things that can take your life. I don't want that for you. So I am explaining trauma to you. And as somebody who has experienced many of those and still continuously on the healing process, I want you to not be a prisoner of your experiences. Okay? So this is serious. Please take it seriously. One way you could do that is by sharing, because someone on your timeline, I just told you, at least one trauma. 87% of you have experienced at least one of those 10 items. And then there are 25% of you that have experienced 3 or more of those traumas. And then the ones of you that have experienced 4 or more of those traumas have a higher propensity to alcoholism, STDs, suicidal attempts, pulmonary disease. So let's get better. Let's get better. Let's do it. So yeah, you're exactly right. Yep. Questions. What kind of questions do y'all have? Again, in 2 weeks, I'm going to discuss treatment. I needed to make these lives separate because I needed to stress the importance of it. And I wanted to make sure I did a thorough job so that when you seek out your therapist or text the word new to the number below to get connected with one of our Yellowbird therapists, then you can say, hey, I think I've experienced some trauma I need to work through. And we will get you on the right track. What's up? All right, so let me look at the comments and see what y'all have. That's smaller than I thought. What, the assessment? What's the therapy you said you'd discuss in a couple weeks? EMDR. People be saying EDMR because it rolls off a little easier, but it's EMDR. Eye movement, desensitization, and reprocessing. What's the okay. Let's see. I am literally deleting stuff out of my memory like you erase things out of a phone. Yep, it happens. Childhood trauma is very real. My mom was murdered by her ex-boyfriend. I still haven't let it go. And it's been, yeah. And she just told us one trauma. That's just like, do you see how serious trauma is? I'm so sorry to hear that, Danielle. So many people have said being an adoptee isn't traumatic, and I disagree. I disagree too. Everyone has suffered from some form of trauma, and that brings us back to what Sharon was saying originally. But yep. April said, "Is that Star?" And then Danielle said, "Is that come here so they can say hi to you because these people love you."
Hey y'all.
That is her. That's her. Let's see. Maisha said, childhood trauma definitely carries over into your adult relationships. Yep, it sure does. I left that part out. Thank you for saying that. Yes, it does. And in fact, your relationships are going to trigger trauma that you didn't even know that you had. That's going to happen. Childhood trauma definitely carries over into your adult relationships when you haven't dealt with your trauma/triggers. I'm sure everyone needs therapy. I thank God for my therapist and my patient husband. Yes. She said, I can't see you. And now they're saying, Star. Why is it that verbal abuse is so common and overlooked in Black communities? It's like a normal way of life. It doesn't follow you. Hey, Star, come here. Because I want you to answer this. Because she's good at answering this question. Since y'all want to see her, I think she should answer. Is it normal to question trauma? Absolutely. It surely is. Come here. Hey, doggy. Hey, sweet doggy. We have 3 dogs. And I love them all. I love all 3 of them. Answer this question. Read it aloud.
Why is it that verbal abuse is so common and overlooked in Black communities? It's like a normal way of life. It does all you. Oh, okay. So because all of that is steeped in slave mentality, white supremacy, that is ingrained in our DNA, right? So we have this as a part of our DNA from so many generations back, and we have not worked it out, right? So we use the things that that we were taught. So during slave times, and we were talked to a certain way, and it became normal, right? We normalized verbal abuse because that was just the way that things were. And because we have not worked that out, and Black people have a really bad relationship with therapy, and we think we can pray everything away, and that if you don't speak it, it's not there, and that if you just ignore it, it'll go away. And instead of working through those things, we continue to pass them down. So it's generational traumas that we don't, and we haven't addressed. That was, again, not our fault. We didn't ask to be slaves, but we were. And then we didn't ask for white supremacy and these ideologies to be passed down to us, but they were given to us. And then we unknowingly hold on to them and continue to perpetuate these traumas on down to further generations. And then that's why we keep doing it, is because we won't work it out. And we haven't realized that it's really not our fault, but it's our fault that we are not trying to fix it, right? It's not our fault that we have it. It's not our fault that it was a thing that was done to us. But because it was done to us does not mean we have to stay there. We can work it out and get rid of it. That's the same thing with physical abuse and discipline when it comes to our kids, right? Those are also things that were given to us. They're steeped in white supremacy and slave mentalities that were passed down from generation to generation. And that's why we continue to do those things too. And we're just now, this generation and maybe generation below us, trying to unlearn those things and trying to work with gentle parenting and those kind of things like that. But the reason why it's so hard is because it's literally in their DNA. And those things require a lot of work to get to unlearn things that are literally in your DNA. So that is why we do it. And the reason why it's more prevalent in our society and in our culture is because we don't like to admit things, and we rather cover them up, and we don't want to take accountability. We don't want other people to know when people are having issues within our family. That's a family issue. Don't tell anybody, they're shamed, blah, blah, blah. Pray it away. And praying it away ain't gonna do nothing. Okay, it's not gonna help. So you have to go to therapy. And even if it's not traditional therapy, you need to talk to somebody and talk to somebody about it. And probably someone who has been through it, and it also is ingrained in their DNA, and they know how to work through it as well. So if you're a person of color, I would say that it's better to talk to someone that's a person of color and that can identify with your experiences, your lived experiences, because they live those experiences too. Because if you are really talking to someone who has no clue what things being ingrained into your DNA, negative or positive, what that means, they really can't help you because they don't identify with the traumas that you're going through, because they don't have those things as part of their DNA because they didn't experience it, or their family didn't experience it generations before, however many generations you want to go through. But yeah, so.
And they would have to be doing an active amount of research and studying. So like,
I'm okay with that. I don't think you can do enough research to understand that.
Well, yeah. I'm just saying to even have an inkling, to even have one small inkling. So a phenomenal piece of literature is Dr. Joy DeGruy's study on post-traumatic slave syndrome. So definitely get that. And so you can understand more for yourself. But post-traumatic slave syndrome by Dr. Joy DeGruy is phenomenal piece of literature. Okay, very eye-opening. Yep. So, yep. Let me see. Yeah, someone said Lakira said gentle parenting is rough.
Yes.
Yep. And then Sharon said, thank you for explaining that. I always said it's not a way of life. Tearing our babies down with words will follow them and leave a long-lasting impression on them. Whew. Whew. Say that. It's meeting other people and realizing that you went through a lot. It's an awakening. It makes you angry and sad. Then you learn to be strong, but not resilient. I feel like that's my experience with wokeness, to be honest with you. That's exactly my experience. Yep, you're right. Let's see. Oh, really? You can't see? Can you see it now? Can you see it all that time? I didn't know. You had just confirmed that I need to finish reading Post-Traumatic Slave Syndrome. Thank you for the yep. Do you have any more information on the correlation between household income and person in the house experiencing trauma? As it relates to what, because if you saw the ACEs discussion, it asked those things separately. So those, as far as adverse childhood experiences are concerned, and just the amount of ACEs in general. But for those two specifically paired together, household income and person in the house experiencing trauma, I will need to do another live. I'll need to do another live to look through that. But that, nope. Not anything I can just kind of just roll off my tongue. So I would want, that's something I think needs to be talked about in more detail. Let's see. I love how you said that if you had a physical injury, you get it treated. I advocate that way all the time. If you have high blood pressure, you take meds. Exactly. Same thing with mental health, especially when you are experiencing trauma or have experienced trauma that can directly impact those things. And the reason that you could be taking that medication is because you experienced a significant, well, even one is significant, but life altering or physical wellness altering level of adverse childhood experiences. Let's see. So April asks, how do you encourage someone to take the first step to getting therapy? I'm going to answer it, but we also got a live coming up for it that Shekinah will be doing, that where we focus on that. Huh? Oh, yeah. Okay. But yes, I will answer that. So very lightly, I would say first start by leading by example and going to therapy yourself and sharing your experience with that loved one to normalize it for them. That would be the first step that I would say take. Even if you don't feel that you need it, it's easier to listen to someone who has been through what you're going through or need to go through. So leading by example, that's the short of it. But again, Shekinah's going to do a more in-depth live on how to support people who may need to be utilizing therapy and just mental health and wellness. Okay. I've been able to do a lot recently on my TikTok lives. Literally, it's happening the last 4 days. Yep. So y'all follow Star on her Star page on TikTok. You have to be a safe space for people. When you are a safe space, it's easier to have those kinds of, yep, that's good. She said you got to be a safe space for people. Let them, feel comfortable discussing with you. Yep, that's Mr. Carter with his beanie. She said my 8-year-old, he thinks everything is negotiable and gets big mad when he can't get his way and be in control. Yeah. So, that is something too that, learning how when your children are their own person and do things that you don't like, that is a lot. I'm not even, because I don't have a kid, but I have a dog and I love him a lot. But when he does things I don't like, it's real hard for me not to zip his ass. So you know what I'm saying? I understand. I'm sure for a child, it's much, much harder. So, that's a thing. That's another way that therapy can assist you with navigating those situations in a loving, gentle way. Mr. Carter, everybody said, hey, actually, that wasn't Mr. Carter. That was Honey. Mr. Carter's bark is way more loud and disorganized. Honey has a more crisp and not as piercing of a bark. So Mr. Carter, like, y'all know how he is. So anywho, yeah, and some people's dogs are more well behaved. Mr. Carter would not be. He is not more well behaved than probably your child. He's probably worse. All right. Any other questions before if you know, any other questions, comments? This has been good. I thank y'all for attending. And 2, listen, you can tell your friends and family to text the word new to this number too, and I'll take care of them. Okay. I will take care of them. I do my diligence to take care of them and you. Like, even down to hiring my therapist. Yes, I'm only a 3-year-old group practice. Well, am I a 3-year-old group practice? So 2020 to 2020, September of 2020 to 21 to 20, almost a 2, just 2. So, we're still growing and developing and all of that, but I am very intentional about the therapist. And now the interns, y'all are going to meet my interns. I got 3 interns and they are bomb AF. I love them. All right. I love them. And they're not Black and brown, but they are aware. They do a lot of social, or have done a lot of social justice work. They're very interested and have taken the responsibility of educating themselves on marginalized populations, which include but not limited to our transgendered individuals, adolescents, LGBTQ community, and of course, like with their social justice work, just, being aware of their privilege, continuing to educate themselves and align themselves with Black and brown people. So yeah, they fine or whatever. They fine. And they will be able to provide free sessions soon. Okay, for those of you that qualify, free sessions for everyone who qualifies. And with 3, I can provide a lot of free sessions for those who qualify. So be sure you share, have your people text this number, and I'll take care of them. I have my interns and my therapists alike go through 3 interviews and provide me with 2 references. I don't just hire people all willy-nilly. I need to be sure. This has been great. I shared, and I hope that it reaches others. Thank you. Yes, and thank you for sharing. Thank you for your support. Y'all have now contributed to breaking the stigma that is surrounding mental health and wellness. So thank you. Great live. Let's see. All 3 of my children are now adults, and I believe that therapy has helped me communicate with them better. Apologize when I'm wrong, and even have conversations with them about the ways my actions hurt them when they were young. Yep, that's great. I love that. You're welcome, and y'all are welcome. All right, if nobody has any other questions, if you know, and you got to be present to know. But if you are on the text community, or if you have gone to yellowbirdcounseling.com and you have subscribed to the newsletter and got 20% off of all purchases from the YBC brand shop, one of them would be this ethical but unorthodox t-shirt, which is going to be redesigned. We're having a redesign photo shoot tentatively next Saturday for models interested. But you know that tonight is our $100 Cash App giveaway. And you did the things, and if you know what the things are. Okay? You didn't know, Star, but I would say since you went to go get some paper towels, because we desperately needed them. Cool. Let me see. I'm gonna give y'all numbers, and I'm gonna count. Let me count, because y'all know how I be screwing up. I don't want to screw up. I don't want to do that. I don't even want to do that. Okay? All right. Let's see. And while I'm doing this, please share. All right, Tiffany, you're 1. Chris, you are 2. Amaris, wait, no. Chloe, you are 3. Chloe is 3. Amaris, you're 4. You know what? No, Chloe, you didn't miss it. Amaris, you're 4. I'm stopping right there because I had to answer Chloe's question. Says live at 8 p.m. Did we miss it? No, you didn't miss it. I started the live late because my last session ran over. And so sometimes if my last session, which should end sometimes around 7:30, but if my client needs more support, then I kind of had to tend to them first. So yeah, and then I still had to get ready. So no, I started a few minutes late. So Mars is 4. Sharon is 5. Nicolette is 6. Natasha is 7. Dez is 8. Chelsea is 9. LaCura is 10. Tracy is 11. Danielle is 12. You got to remember your numbers. April is 13. K Candles is 14. Charmel is 15. Ooh, y'all came out. I already got you, April. Okay. Let's see. Janine, 16. Every day, 17. I think, let me see. Make sure I didn't miss nobody. Toya. Toya's 18. And that is it. You ain't getting no number. You ain't getting no number. You don't need no number. I didn't see you. Hazel. I didn't see you. Did somebody else, did I miss her? Did somebody or them? Because I don't know what your preferred pronouns are. Them. Did I miss them? I don't remember seeing you. Oh my gosh. I'll just give you $100. How about that? Okay, Toya says I miss you. So, okay, you're 18 then, Hazel. Oh, okay. Yeah, well, I gave her a number. I gave you 18, so you'll have a number. All right, thank you. Thank you, Toya and Lakira. All right, so we got 5, 10, 15, 19. Wow, y'all came out. I appreciate y'all. I really do. Toya, I thought I gave you a number. No, because I marked it as I gave people their number. I marked it as I gave people their number, so I caught up with it. Y'all. Did I? You sure? Yeah. There's 19. 5, 10, 15. Yeah, so okay, she's 19. Hazel, you're 19. Toya, you're 18. Yes. Maisha, did you do the thing? Did you do it? If you did it, then cool. Yep. Let me see. Maisha, did you do the thing that you had to do? You see it? Okay, thank you, Lakira. All right then, Maisha. I'm gonna give you 20, okay? That's your number. That's your number. That should be everybody. Y'all was just commenting so much. I appreciate you. Oh my gosh. Yay. So Maisha, you're 20. And that's why I told y'all keep up with your numbers, because there is no way I'll be able to go back and tell you who. I can tell you how many people I'm supposed to have, but I'd have to go all the way back up and count again, which would take more time. So that's why I was like, remember your number. You didn't miss nothing. You didn't miss nothing. Just don't leave, because I'm about to put the number in. Let me share my screen, because again, I don't want nobody to think that I'm playing favorites, because I don't do that. I do not do that. Thank you, Toya. Thank you. Y'all really came through. Y'all be supporting, and I appreciate it. All right, let's share my screen. Right from the Google search. That's how I do it. All the way from the new tab, from the Google search. Oh my gosh. Start, come home and get $100, okay? All right. Number generator wheel. So I got to put 20 in there. Number picker wheel. All right. Yeah, I'm so excited. All right. So here's the wheel. Listen, didn't do nothing. Y'all saw I literally just clicked on this and came in here. So, it's only 20 though, not 22. So the minimum is 1 and the maximum is 20. Why is it? Okay, there. All right, we about to spin. Oh, shit now. Let's spin. It's between Toya and Azel, or was it? 18. Who got it? Who's 18? Who's 18? Let me see. Who got it? Toya. Yay! She got it, y'all. Give her hearts and likes and all the congratulations. Yay! Yay! Love it. Let me send it. I'm going to send it to her now. I'm sending it now. Sow that away. Hold on. Let me go out of IG so I can come back and share the live, because sometimes it fucks up. Oops. I don't know if I can say that on Facebook, but oh well. Sorry, Facebook. I didn't mean to say that word. All right. All right, let me send it. And then it's gonna say congratulations. Yeah. All right. Congratulations from Yellowbird Counseling with our 3 hearts. Okay. Let me get Toya's. Oh, yep, great, thanks. I was like, ooh, please send your Cash App again. All right. Got it. Let me make sure it's the right person. Yep. All right, sending it now. Sending. See, I know I don't cap. Booyah! You got it. So if you get paid this Friday, that's $100 free. You ain't got to take out your paycheck. And if it was me, I'd be like, yo. So congratulations. I love it. I like giving it to y'all. So if you want to know, if you want the chance to win, you need to either text this number below, or you need to go to yellowbirdcounseling.com and become a part of get on the newsletter, and also get your 20% off of our mental health merchandise that helps you say it with your chest. Make your mental health statements with your chest, so you can start the discussion with others about mental health and wellness, and aid in the effort to break the stigma that does surround mental health and receiving mental health treatment. All right. So I got it. Y'all, I got a beautiful new therapist who's very near and dear to me and was around when I had to make the leap for not working for nobody else because that didn't work for me. But I brought her on board as a new therapist, and you are going to love her. And so next week, I'll be introducing her. And then the following week, I'll be talking about treatment for trauma, okay? And the treatments that we offer for trauma. But in the meantime, she got it. She actually got it. Ain't no cap at all. All right. I will see y'all. It's been a great evening. So come back, like Craig said. Hey, come back next Thursday at 8 p.m. Central Standard Time. Follow the page so you don't miss the live. And we will see you again then. Have a good night, y'all.